Hello students, welcome to VHS e-classes and today we are going to discuss about quantitative research approaches. In a previous lecture we have discussed about the various qualitative and quantitative approaches at a glance, and in today's lecture we are going to discuss all these approaches in detail. So the first what we are taking is quantitative research approaches. Actually it is a approaches, okay. So when you talk about quantitative research approaches where you collect the data in a numerical form, that is a one point you all need to remember. Let's talk about the quantitative research approaches. So in designing the quantitative research studies, researcher has to consider many things like their practical implications, their ethical considerations, and there are some theoretical challenges as well. So it is based on the evidence-based practice. So whenever you collect data or you plan to conduct a quantitative research approach, your ultimate purpose is to generate the evidences which are scientific in nature, testable, or fulfill the principles of science. So primarily, if you say quantitative research approaches are the approaches which follow the positivist paradigm. Which one? Positivist paradigm means they believe in a principle of science. Okay, so when the researcher is interested to study the variable which can measure in quantity, it is called quantitative research. It's something you measure in a quantity. Like for example, if you want to measure the HB percentage of somebody, or if you want to measure the blood pressure of someone, if you want to assess the age of somebody, or blood pressure of somebody. So all these are basically the quantitative variables, and to measure that you need to conduct the quantitative research approaches. Now broadly, if you see that quantitative research approaches can be classified as experimental and the non-experimental. Okay, so experimental and the non-experimental designs. So broadly, if you see that in the experimental design we have three basic designs, whereas in non-experimental design we have three basic design. Now here I would like to tell you, this is a classification which I found suitable for you as undergraduate and postgraduate nursing students. If you follow books other than my book, then there could be some other type of classification, but they are almost similar. So I try to classify in that way. So if you look at the first category, that is a true experimental design, then we have quasi-experimental design, and then we have a pre-experimental design. So we'll discuss all these three in detail. And there are 6 basic designs, as you can see, in a true experimental category, 2 designs under the quasi-experimental, and the 2 categories or 2 designs under the pre-experimental design. Similarly, if you look at the non-experimental category, so in the non-experimental we have descriptive designs, we have a correlational designs, and we have a other category, that is a other designs. Okay, so we can categorize in that way. So let's discuss one by one in detail. So first we are going to start with the experimental research designs. Now, what do you mean by experimental research design? So first try to understand what do you mean by experiment. So experiment is nothing, it is something where you determine the if and then relationship. That is the experiment. Okay, if and then, like if you increase diet, then what happens to your body weight? So when you have that kind of things, we call it a experiment. Okay, and of course whenever you do such kind of manipulation where already we have introduced the variables, so if is your independent variable, that is a causal variable. Okay, like diet is a causal here, and then is your dependent variable. So here in this case the weight is the outcome variable. Okay, so when you do that manipulation of one variable to evaluate its effect on another variable under controlled condition, we call it an experimental. Now application of control vary from design to design. So on the basis of how much control we put on a specific design, we have a further division of that. So we'll see that. So experimental designs are primarily approach which used to investigate the cause and effect relationship, which already I have told you. Causal relationship means if and then. If you introduce a specific intervention, then what is the outcome of that? This is a traditional type of research that is quantitative in nature. And when we say it is traditional, means we are saying it's basically believe in a hard science. They always focus on generating the evidence which are scientifically testable. In this design, one variable is manipulated. That I have given you the example, like in the previous example, the diet was manipulable, and if you see its effect on the other variable, that is the weight. Okay, so experimental designs are used in the way to answer the hypothesis. Hypothesis, already I have told you, it is a predictions. So if my question is there any changes in the body weight if I manipulate a diet or a calorie intake of somebody? So this is an research question, or you can frame it in the form of an hypothesis by saying there is a relationship or there is a changes in the body weight if you manipulate the diet or calorie intake of somebody. So that is about the basics of experimental design. Now before we proceed, we need to understand some of the important terms related to this experimental designs. So even though most of these are already introduced in my previous lectures, like one is an independent variable, that means a variable which is causal, which cause. Okay, manipulated means the variable whose impact you want to assess or evaluate. Then we have a dependent variable. What is dependent variable? It is an outcome variable. That is the outcome variable, and what you do here, you manipulate an independent variable and you see its effect on some other variable, that is the outcome variable. Now we have experimental group. What is experimental group? A group that introduced to the independent variable. Like for example, if I have a group of 20 people who receive a specific diet for 30 days, whereas the another 20 people who receive the normal diet for 30 days. So in this particular example, this one is your experimental group, or what we call the interventional group, and the second one group against which we are going to compare the effectiveness or efficacy of that intervention is known as a control group. As you can see in the slide, control group. Okay, so the group receive no or standard treatment. Okay, so that's a control group. Another term is a hypothesis, which already I have told you. Hypotheses are the statistical predictions about the expected relationship among independent and dependent variable under controlled conditions. So that we call a hypothesis. Now, what are the steps that one can follow while conducting the experimental research? So this particular slide have your theoretical as well as the practical implications. So some of the things are very common, means it can be used for even for the non-experimental designs, but some of are very exclusively used for the experimental designs. Let's see that one by one. So first is select the topic. That's a very common point, how to select, but already we have discussed. Then identify the research problem in that. Let's say I have selected a topic of nursing education, and then I have to identify the problem. Let's say I just want to see the developing the to enhancing the compliance of the teachers to the norms. So in that way I can identify the problem. Then you conduct the literature search. Already we have taken lecture on that. Then now here this is exclusively we do in a experimental design, construct the hypothesis. Now dear student, please remember that all the experimental designs are governed or guided by the hypothesis. What is hypothesis? It's a prediction about the expected relationship among variable. Once you do that, the next step is about your determine the design. What design you are going to use? Okay, so in experimental also there are various designs are available, like as we have discussed 6-7 designs though already I have listed here, but there are many more. So you have to decide which design is more suitable, and sometime when you decide which design is more suitable, you also have to check the feasibility of design. Feasibility means is a practicality. Okay, sometimes designs are more suitable, but it is not, it's a practically not possible. Okay, so then determine the research method. Okay, so this is how we are going to conduct your research. So entire plan for data collection, okay, all these things you plan here. Then conduct the research and the test the hypothesis. Okay, so this is how you can carry out your experimental procedures. So we'll discuss in a various design, there are different procedures that we need to adapt while just delivering the intervention. So here we can use the protocols. Okay, like one, we have a experimental protocol and control protocols. Okay, the protocols for control group that we do here. Then we do the analysis. So of course it is a quantitative research design, so we do analysis with the help of statistical softwares, and finally we formulate into the conclusion from that research. So these are some of the important steps that you can follow while conducting the experimental research. Though some of the steps like selecting the topic, identifying the problem, conducting the literature, okay, these are very common. Then determine the research plan, conducting this analyzing the data and formulating the conclusion. These are common to other research approaches or designs as well. Now let's start with the experimental designs first, which already I have introduced. So what do you mean by the experimental? So before we go to have that understanding of experimental design, let's have the understanding of this. Okay, is there an intervention? That is the first point. Is there an intervention? If answer is yes, there is an intervention. Or then second question, is there a random assignment to the treatment or control group? Okay, you say that yes, we have an intervention, and let's say your intervention is a diet program. So how you are going to assign that? Are you going to assign using some random method? If answer is yes, suppose you have 100 people to receive an intervention, how you are going to do that? Okay, so you divide 100 into maybe 50 or 50, and how you divide that? You divide by adapting a probability methods. So where it is out of researcher control that which subject will go in which group. Then we call it a random assignment. If answer is yes, then we call it a true experimental design. If there is no, then there are some other designs. So as of now, I'm just talking about this only. If there is intervention, yes. Then is there is a randomization? Answer is yes. Okay, then we call it it is a true experimental designs. Okay, let's say, so experimental designs are having three principles, or what we call that characteristics. Three characteristics. What is that? Randomization, control, and manipulation. Please remember that. It is a very probable question in the exam. They may ask you the principles of true experimental. Okay, principles of true experimental design. Then you say there is a randomization, there is a control, and there is a manipulation. So let's discuss about that. So first we can start with, like, first is a manipulation. That is a very important. So manipulation will be there in your true experimental also, in the quasi also, and in pre also. We'll discuss that. All these three different types of experimental designs are there. So this principle is applicable. Manipulation is a common principle for all these designs. But the design which has manipulation plus control, okay, then we call it a quasi. Then the design which have manipulation plus control plus randomization, then we call it true experimental. This is what I'm talking about. So remember, the true experimental design will have all these three principles: manipulation, control, and randomization. For quasi experimental design, we will have two principles, that is manipulation and control, but randomization will not be there. That is why quasi-experimental designs are also known as non-randomized control trials. Okay, so let's discuss about the one by one with all the principles. So first is the manipulation. The first principle is the manipulation. So what is that manipulation? Or in simple word, we say intervention. Now, researcher has some intervention which is designed and structured and administered to this some subject and withholding from the others. Like for example, diet. I said the specific diet program would be given to, let's say, 50 subjects and withheld from the another 50 subjects. So manipulation is what? It is an intervention. Now, what are the features of intervention? It is planned, structured, and deliberately controlled by the researcher. That we call a manipulation. So here you have, as you can see, there is an independent variable which you manipulate. Okay, you put that and you just observe its effect on the outcome variable. Like for example, diet I said, and here outcome is on weight. So what is the impact of diet on the weight? So that is a manipulation. So there are different way of doing manipulation of independent variable. Sometimes you in the form of a control, you can have a specific intervention. Okay, that is tailored design. And remember one point, whenever you have the intervention, you always have to have your interventional. What is the intervention? Okay, how it is different from others, how to administer, okay, how long to administer, who will administer, and under what condition you have to withheld this. Suppose if you introduce an intervention or a treatment, then what are the conditions where you are going to withhold this? What instructions required for the people who are going to introduce? Okay, what trainings are required? What safety measures? Is the intervention could be potentially dangerous to someone? So all these questions you have to answer under your intervention protocols. Okay, so you have to carefully design. Your intervention protocol should be documented in such a way that if someone want to repeat the same intervention in a different setting with the different subjects, he would able to do that. So the documentation is very important for the intervention. Now let's move on the second principle, that is your control. So when you talk about the control, what do you mean by the term control? It refers to the group of subjects whose performance on the independent variable is used as a basis for evaluating the performance, or what we call that counterfactual. Okay, comparison group. Okay, so there is a two basic meaning of control. If I talk in a broader sense, control means how you are going to control the effect of confounding variables over the outcome variable. Like diet, and I want to see its effect on your weight. So in this particular case, other than the diet, there could be some other factors, like maybe your genetics, your age, your gender. All these variables can also affect the body weight of somebody. So what measures you have to do, and you have to control these variables. Already we have discussed that in one of our lecture, how to put the control and what are the confounding variables and all these things. So all these variables which may affect your outcome, and researcher deliberately want to control these variables, that we call a confounding variable. And the process that one adapt to control or minimize the effect of such confounding variables is known as a control. So how you achieve control? You achieve the control by having various things, like you are by having a one measure is a control group. Control group. That is a one way of achieving that. Okay. So control is used to prevent the influence of outside factors, extraneous variables, which already I have told you, from the influencing the outcome of the study. Like diet having an impact on weight, I want to establish that relationship. But other than the diet, there could be gender, age of a person, genetic, all these can also affect the weight of the person. So I have to put the control in that. Now, so one method of doing is by having a control groups. Control group. Now, how control group measure that? If you remember that previous lecture where we have discussed about the internal validity, where I have said we have to do all the measures to determine the purity of relationship between independent and dependent variable, where we try to be confident enough to say that outcome is only and only because of the independent variable, nothing else has caused this. Okay, so there are certain way of having different types of control groups are there. Before I proceed to the various categories of control group, I just want to take one example to understand the importance of having the control group. Let's assume that somebody having a group of 60 premature infants, okay, and he just wanted to see the effect of a stimulation program. He just want to see if we provide any kind of like tactile stimulation or auditory stimulation, what will be the effect of stimulation on their, let's say, reflexes. Okay, scenario is clear. There are 60 premature infants, okay, and I want to see the effect of any stimulation program on reflexes. First, I'll make a hypothesis, and my hypothesis would be like stimulation program will have positive effect. I will have effect. So in this particular case, let's assume if suppose I have taken 60, first thing is I have to divide that 60 into 30 and 30. 30 infants I'll keep as experimental group and 30 I'll keep as a control group. Okay, how do I divide them? I divide them by having a randomization, random methods. Okay, now baseline assessment was done, observation was done, baseline assessment is reflexes we have checked, maybe the body weight we have checked. Then we have provided them a tactile stimulation program and they received the standard treatment, and after 3 months of that we again made the second observation. We just wanted to see the effect after 3 months. Let's say the effect on a tactile stimulation or maybe the weight. Now after 3 months, suppose this group is having a better stimulation, this group is having a better reflexes or weight, body weight. Can we say that this is better than pre-test? Yes. Maybe let's assume that the reflex rating on pre-test was 0.2 has increased now to 0.7. Can we say this that the stimulation program is effective? The answer is no. We cannot say that until we compare this 0.7 from what has happened to the infants in a control group. Let's assume they also had a same 0.2 rating and after that they have reached to the 0.5. Now even without intervention you can see that they also have improved in their reflexes from a score of hypothetical score of 0.2 to 0.5. So instead of comparing pre from post, we have to compare experimental and control. So that is the importance of control. Now, by having a control group, what we have controlled? We have controlled the effect of maturation, effect of time, and this time is known as a confounding variable or extraneous variable. So that is why having a control group is very important. Now the question comes, what are the different types of control conditions we can put? Means there are two groups. One group will receive the experimental treatment known as the experimental group. Another group will receive either a placebo control, means they will receive some psychological effect, like what we call, say, maybe suppose you are giving a one medicine, one tablet, okay, to the experimental subject. You can give a same kind of tablet to the control group as well. Same kind of means the tablet which has a zero biological value or therapeutic value. It may look similar in appearance or in a color or in a size, but it do not have actual impact on that. Okay, so that we call a placebo control. Okay, so that's a one point. So dummy treatment, what we call that. Second way of having control group is a dose comparison group. Here what we do, we can compare the different treatment dose to find the optimal level. Let's say one group is receiving tactile stimulation once and another group is receiving tactile stimulation twice. So one group is receiving stimulation program only once in a day and another group is twice in a day. So in that way we can say dose variation and treatment variation. There is another variation is a no treatment control. In that what we do, one group will receive experimental treatment, what is planned, another group will not receive any treatment. Okay, so they will not receive any treatment. Then another thing is a wait list treatment. It is, I think, very popular these days because of the ethical consideration. It is nothing, it's the same, you provide the same treatment but after the data collection. Let's say tactile stimulation was given to the 30, okay, the same stimulation program you can give to the subject in a control group as well, but after the data collection. Okay, so that we call a wait list control group. Like, you know, usually in the studies where you have the educational interventions, so you can provide the same educational intervention to the subject in the control group but after the data collection. Then another important thing is standard treatment control. Okay, what is that? You only manipulate the experimental group by having by having your intervention, and you follow the standard treatment for that. Like for example, in a study we have provided specific type of intervention to control the neonatal jaundice, whereas the other subjects or infants in a control group receive the standard care. We cannot refrain, we cannot prevent them to receive the standard care. Okay, apart from the standard care, we have also introduced this treatment. So these are some of the important, there are many more, like we have a dummy treatment and there are others, but these are the important ways or variation in the control group. I hope it is clear to you now. Third important principle or characteristics of experimental design is a randomization. Now, the term randomization means that every subject has an equal chance to be assigned, please underline this, to be assigned in experimental and control group. Okay, I've told you somewhere that, people say that randomization and random sampling are same. Okay, are randomization versus random sampling. Now the question is, are they same? That is the question. Okay, so please find out and write me that in the comments. Is the randomization and random sampling are same? Okay, so what is randomization? Randomization is an assignment where you assign the subjects in the experimental and control condition. Okay, and it is most trustworthy an acceptable method of equalization of group. The ultimate purpose of randomization is to equalize the group. That's the point. Okay, so like for example, if I have a 60 premature infant and I have to divide this 60 into two group, one group in experimental and control. So how do I do that? I do by random sampling, sorry, by random, adopting the random method. Simply, like simple example if I give you, you can have a simple lottery method where you you know, provide an equal probability for each of the subjects, each of these subjects in the study to be participated or to be selected in the experimental or control group. So randomization is all about that. Now, the main purpose of randomization already told you is just to equalize this. This is just to equalize the group, okay? Like whenever you are going to compare two groups, you have to ensure that the groups are equal, okay? So randomization doing this work very effectively. Now, what are the methods of doing randomization? So may not be much relevant theoretically for undergraduate students, but it has a lots of practical importance. I have seen the studies where usually we do a simple randomization, but we also should understand what is block randomization, what is stratified randomization, and also the Zelen randomization. So let's discuss one by one. What is simple randomization? Let's see. Now, simple randomization means, once again, the basic method of using the random assignment. That is a simple randomization. Let's say you have 10 subjects. Let's 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. And these 10 subjects, I'll just take an example. Okay. These 10 subjects selected. How you select? Whatever is the method. Okay, you can select by adapting the random selection, or you can have, any other non-probability sampling as well. Now, you have two treatment A and treatment B. Treatment A could be your experimental treatment and treatment B could be your control treatment. In control treatment, it could be like placebo treatment or a different dose or wait list, or it's a standard treatment or no treatment, any of that category which already we have discussed. Now, as you can see, you put a lottery and just the person 1, 4, 3, 8 and 10 in the treatment A, whereas 2, 5, 6, 7 or 9 in the treatment B. So the participants are assigned into two groups by the randomization. So this can be done very effectively. So that is a simple randomization. No, there is a problem with the simple randomization. Okay, I'll come back to this, but before that, let's understand what is a block randomization. Because once we understand the block randomization, then only we can understand the problem with the simple randomization. Okay. The block randomization method is designed to randomize subjects into groups that result in equal sample sizes. Number one. Blocks are the small and balanced with a predetermined groups assignment which keep the number of subjects in each group similar at all the time. As you can see with this example, in a block randomization, keep size of each group similar, okay, over the entire study. So usually block randomization is required when you have sequential sampling. Now, some of you may ask, what is sequential sampling? Simply you try understand that when you collect the data over a period of time, because subjects availability is not there. Suppose you wanted to collect the subject visiting OPD for suffering from a specific disease, and every day you are getting only 5-6 patients, and your sample size you want to have 200. So every day only 5 people are coming or 4 are coming, so you have to decide 4 from the 4 only. So now you have to decide for today's these 4 to be assigned in experimental control group. So in such situations we can use the block randomization. So as you can see here, suppose once you recruit your sample, you made a blocks. This is for example day 1. As I said, you got a 6 people to today. So there are possibilities when you have 6 people today, most of them can go in either experimental group or control group. So you have to prevent that. You have to make sure that if there are 6, the 3 should go in intervention and 3 should go in a control. That is a problem with the simple randomization. Okay, let's say there's 6 people. Now, suppose this one person is coming to me and he has given 2 choices, experimental and control. And by luck, this person got experimental group. Second person also got experimental. Possibilities are there. Third person also got experimental. Fourth person also may got experimental group. So in that way, it will not equalize the group. So to overcome with that problem, what we do, we can always have a blocks, and we have to ensure that in each block the equal number of subject to be assigned in the intervention and the control group. To understand this in a detail, let us consider the example in the table. Let's say what this example says. Now, this is what you have to see very carefully. Now, this is an example of simple randomization. This is an ideal allocation. That's, as you can see, ideal allocation means, as you can see, there is a two treatment A and treatment B, right? And very nicely the subject, patient 1, 2, 3, 4, these 4 patient got your treatment A and remaining 4 patient got treatment B. This is an ideal situation, but practically is it possible that every person got selected in treatment A only or in an equal manner? The answer is no. Now, simple randomization with a defective allocation. This is very common. Now, what is that? All same 8 subjects, out of that, this person selected in group A, group A, group A, and N. Now, out of 8, there are 6 subjects who got chance of being in the experimental group because it is a probability selection. So, to equalize that group, equalize the treatment or ensure that all these 8 subjects or patients selected to be selected in experimental or control group equally, we go for the block randomization. Okay, so all 8 subjects divided into the blocks. Block A, as you can see, this is a block A where we kept the 4 patient, and block B again 4 patient. Now I have to ensure that the 2 from block A should be in experimental group and 2 from block A should be in a control group, as you can see. So this is how we are going to use the block randomization. Okay, so 2-3 points you should remember. The block randomization is a improvement over the simple randomization. The problem with the simple randomization is that sometimes group may not be equally allocated in the different treatment conditions, so we can go for the block randomization. Second thing, if you are not recruiting all the samples at a one time, or your samples are coming in a over a period of time, so you can always make a block. Like for example, if suppose 7 patients or 8 patients are coming in a OPD, so 8 patients will be given a block A. Now I have to ensure that out of these 8 for today, half will go in experimental and half will go in a control group. Next type of randomization is a stratified randomization. So use of stratified randomization when the subject characteristics such as age, weight, gender, marital status or any other characteristics which researcher feels that might have affect the outcome, then we can have the stratified randomization. Now some people get confused between stratified randomization and block randomization, but please don't confuse. As you can see, stratified randomization where you do randomization by considering specific strata. What is strata? A group, like for example, male versus female. For example, Hindu versus Muslim. For example, rural versus urban. Now, suppose you are doing an intervention among the women and you have taken a 200 women. Now, these 200 women from the 100 urban and 100 rural. Urban and rural. So you have to ensure that equal number of women should go in a control group. Like there should be, if I'm talking about the experimental group with 100, there should be proportion of 50 and 50. Same way there should be proportion of 50 and 50. So each group will have 50 urban women and 50 rural women. Okay, so here the base of making that block is your specific characteristics. Okay, as you can see, weight, gender, marital status, disease severity and many other more, greatly influenced by the treatment effectiveness. So this is what you feel like. In a previous example, if I go for a tactile stimulation, you can have a stratified randomization where you can make one strata of all the male genders, means male infants, and another for the female. So as you can see with example, selected participants A, B, and all that. Strata A4 stand for male and B stand for B. So as you can see, there are 6 in one strata, having a 6 male, whereas the second strata having a 6 female. Now what I have to do? I have to select, like, this A will go, this male will go here as well as here. So as you can see, 3 males are here and 3 females are there. So in that way we are going to make the stratified random sampling. And people confuse between stratified and block because the ultimate outcome of both are the same. Whereas in a block design, we have some different conditions. Now, another important variations in the randomization or type of randomization is the Zelen design. So what is Zelen design? Even though it is a controversial, ethically there are many issues in that. No, patients are randomized to either treatment or control group before giving informed consent. Usually what is the process? First you select, then you consent, okay, and after consent you just do randomization and control. But in this particular design, what you do, you select your participants. Before doing a consent, you do randomization first, and those who are saying yes, we are okay with the research, we want to participate, especially the experimental group, then we can keep their, we can take their consent. If they say yes, we'll keep them in study. If they say no, we have two choices. Either we'll discard them, means we will exclude them from the research, or we will put them in a control group. Because control group in this, control group means a group who is receiving the regular treatment or standard treatment, okay. So in that way, Zelen design is working. So some of you can ask, what is the need of taking the consent after randomization? Let me tell you. Usually what happens, sometimes people agree to participate in your research if they are being selected in a specific group. So their preference are there. So if people, suppose we say there are 10 people who got assigned, and 5 here and 5 here. So we'll tell these 5 people that you got selected in experimental group, would you like to participate, would you like to continue? So if they say yes, we are okay with that, or we don't say which group you selected, we are saying you may select in any of the groups. Are you agree to participate? If they say yes, we'll keep them in experimental group. Otherwise what we can do is we can move them to the control group, or we can exclude them from the research, so that we can save the time. Like if suppose the people says no, I will not participate, if suppose you have taken consent here and after that you did randomization, then people will, they will drop out from the research. That is a Zelen design. No, consent was asked after the randomization and only from the subjects who are selected in the experimental group. Yeah, that is also the one point. Sometimes we don't ask from the control group. But again I say, we should take consent from all the subjects, either they are in experimental or the control group. Now, the last of these 3 principles, I just want to discuss these 2 important terms. One is a blinding or masking, another is a allocation concealment. Now, what is a blinding or masking? It refers to the concealment of the group allocation from one or more individuals involved in the clinical researches, especially in the RCTs. So what is a blinding? Concealment means hiding. You are hiding in which group they are allocated. Like for example, if subjects are in experimental or either in a control group, you will not reveal in which group they are. Or maybe sometime researcher who is conducting the research may not be knowing in which this particular subject belongs to which group. So that kind of things we call it a blinding. So blinding, why? Because whenever we do blinding, we wanted to control the placebo effect, we wanted to control the awareness bias, we wanted to control the psychological effect of being in the research, okay. So for that purpose we do that. So blinding are of different types. One, we have a single blinding, double blinding or triple blinding. You can read from here. Single blinding means where the participants does not know in which group they are, whether in a treatment or control group. Now please understand one more point here. Sometimes student says blinding means the subjects are not aware whether they are the participant of research or not. This is a wrong answer. They aware about their research participation, but they have been concealed about their group allocations. Remember that, okay? What is double blinding? In double blinding, your participants as well as the chief investigator or principal investigator may not be aware about that. Like why? Because sometimes, like suppose I am doing one intervention and I know these people are getting the intervention, so I can manipulate that, and sometimes the effect would be higher or towards positive side. So we can keep that principal investigator also out of that. So we can, in such conditions or such things, we call it double blind experiment. Now what is a triple blinding? Here neither subject nor the person who is administering the treatment, maybe the researcher, nor the person who is actually evaluating the response or the treatment, like who is measuring the outcome variables. So in that condition, like suppose I just want to introduce a tactile stimulation program, or let's say diet program, to the one group and standard program to other groups. So one specific diet, the subject may not be knowing what specific we are getting in that particular diet. Almost similar diet we are planning, whereas researcher also is not involved in that. So somebody else will do the allocation of the subject in different treatment condition. Now somebody is there to administer the diet program, so they also will not be aware what diet I am giving to whom. So in that condition we call it triple blinding, and it is very, very essential characteristics. Remember, the purpose of blinding or masking is to prevent the awareness bias, to minimize the effect of psychological effect, or what we call a heteron effect of the subjects as well as the researchers. Now what is allocation concealment? Even though I have started that blinding is a concealment, so is there any difference between concealment and blinding? So the answer is allocation concealment is completely different from the blinding. Please remember how it is. The allocation concealment seek to eliminate the selection bias during the process. Now I should not be involved. I should not be involved which subject should allocate in which group. Otherwise I may be biased. So to avoid that, we do allocation. Allocation means subject allocated to treatment groups, either in experimental or control. So that we call a allocation, or that we call a allocation concealment. What is blinding? Whereas the blinding seek to reduce the performance bias after the randomization. Now blinding is a broader perspective. In a blinding, researcher may not be aware, or he will be excluded from the allocation. He may not be knowing that who is receiving what treatment. Administrator, the person who is giving the treatment, may not be knowing what kind of treatment I am giving. Why? Because I just want to control or reduce the performance bias. Or subject, if suppose a subject aware that I am getting some specific treatment, their natural behavior may change. So that is about the three important principles of experimental design. So today we have discussed about the basic introduction of experimental designs, where we have seen that experiment are nothing. These are the designs where we apply specific research methods to manipulate the independent variable and to see its effect on the outcome variable. Whenever we talk about the quantitative research approaches, in that we have two categories. One is experimental, another is a non-experimental. In experimental, already I have told you, experiment is something where we manipulate the independent variable to see its effect on outcome variable under controlled conditions. Further, the experimental designs are classified as true, quasi or pre. And there is a further division. So three major principles we have discussed today. One is manipulation or intervention. That means it is in treatment what researcher is giving to the subjects. Second is a control. Control means all the measures you do to minimize the effect of confounding variables over the outcome variable, and this we adopt by having a control group or by doing the randomization. What is randomization? Randomization is a random allocation of the selected subject to different treatment conditions. So I hope आपको ये समझ में आया होगा, और नेक्स्ट लेक्चर में हम डिस्कस करेंगे अबाउट वेरियस एक्सपेरिमेंटल डिजाइंस. सो थैंक यू सो मच.